With the Omicron COVID-19 variant surging and many spending quality time with loved ones this Christmas, some people are flocking to get COVID tests, as you might imagine. CBS 2's Charday Gray is live outside of a testing site on State Street in Jackson. You've been to a lot of testing sites, Charday, I understand. What has the line been like at these various spots?
Yeah, that's right, Chris. We went to at least a dozen testing sites around the downtown area, including this one right here off of State Street in Jackson. And the lines were various. We even had reports from co-workers who live in the suburbs who said that they saw long lines. So you can imagine those people who were waiting were anxious to get tested. Whether you're headed out for vacation.
We're traveling to some of our friends in California, and we wanted to make sure that if we're going there, although we are all completely vaccinated, we want to be sure if it's negative.
Or had family members in town for the holidays.
All 4 of our girls came in and 2 of them tested positive.
Getting tested is likely the first thing on your mind. Joselle Yulin tells us one of her daughters, who lives in Virginia, spent 2 hours with them. The test came back positive and she drove back home.
Our other daughter lives in Georgia and she tested positive on Christmas Eve. They were in the middle of opening presents. They went to the basement, drove home.
She tells us she's gotten both vaccines as well as the booster and had COVID a few months ago.
I don't want to get it again.
Are you familiar with the CDC guidelines? Like if you're vaccinated, wait like 5 to 7 days or 3 to 5 days?
Absolutely. But you know what? The guidelines are guidelines, and we want to be very proactive and make sure everybody that we come in contact with is safe.
So we asked Rush Hospital Dr. Elizabeth Davis, Medical Director of Community Health Equity, why you should wait if you're in a situation like Yulin.
If you were exposed, let's say yesterday, and you test today, your test may come back negative, but it would be a false negative because it would be just too soon for the test to pick up the COVID.
But if you're showing symptoms, whether you've been exposed or not, and even a simple runny nose, sore throat, or headache,
get tested. And you can get tested through home test, through a PCR test, like at a pharmacy or a clinic. There are many different options to get tested.
So you're probably saying to yourself, well, the at-home testing kits or the testing site, those are hard to come by. So we did ask Dr. Davis that, and she said that Rush Hospital made an initiative with the Esperanza Health Center, partnering with the Chicago Department of Health to make those at-home testing kits available to you. They're giving you that option. So they said it's pretty simple. All you have to do is order that PCR test. It'll be FedEx to you. You FedEx it back, and then you get those test results within 4 days, which Dr. Davis says that's in the time frame of being exposed. Chris?
Hey, thanks very much. Appreciate that.